Hi, everybody. This is Dr. Nam Lee from Lee Acupuncture at Newport Beach. I have a special guest today, Dr. Frank Yelian. Hi, Doc.
Hi, how are you, Dr. Lee?
Yeah, good to see you.
You as well.
So, he's Dr. Yelian. Let me tell you, he's a super busy, super famous, but he's a very friendly doctor. That's my impression. I guess you hear a lot from your patients as well, correct?
Thank you.
So let me read his bio briefly. Dr. Frank Yelian, MD, PhD, is a founder and medical director of Life IVF Center, is a board-certified obstetrician and gynecologist who received a special fellowship training in reproductive endocrinology and infertility. Dr. Yelian has over 30 years experience in the field of reproductive medicine and then women's health. He graduated from the Zhejiang University School of Medicine in 1983. He then came to the United States in 1987 and worked at the Endocrine Research Center at the Michigan State University. He earned PhD in reproductive endocrinology and embryology in 1991. He joined the IVF program as a postdoctoral fellow and worked as an embryologist at the Wayne State University. He promoted as associate professor, and he focused on the assisted reproductive technology and the minimal invasive gynecological surgery. Dr. Yelian has gained extensive experience treating patients with PCOS, endometriosis, recurrent pregnancy loss, and premature ovarian failure. He has over 100 publications, and he has received numerous national and international awards. In 2009, Dr. Yelian took a sabbatical leave to work at the Gato Ladies Clinic in Japan, where he mastered the new techniques and skills of natural cycle IVF and the minimal stimulation IVF. In 2010, Dr. Yelian founded the Life IVF Center in Irvine, California, and now it has become premier fertility center in Southern California, specializing in natural cycle IVF and the minimal stimulation IVF. Dr. Yelian is highly recognized as a world expert in the field of infertility, especially in treating patients with endometriosis and diminished ovarian reserve. Many patients are coming from the outside of California to Irvine for fertility treatment. He also has many patients from all over the world. Wow. Amazing, Doc. I read you said you start with a small, I don't know, it's 3 or 6 page, your staff. Now you grow a huge practice in Irvine. Is that right?
Thank you. Yes. Thank you very much for the kind introduction. So yeah, it is correct. And so 10 years is a long time. So actually we are celebrating 10 years anniversary of this year. And so usually we have a big celebration, and we always have we plan for our baby reunion and for all the baby delivered from Life IVF Center and get together. And but unfortunately, because of COVID-19, so we have to be postponed for this year baby reunion.
Oh, okay. So tell us a little about your practice, Doc.
So our practice is, as you know, in Irvine, California, and so has been here for 10 years. And so beginning very small, as you said, we have 3 employees. Now we have about 64 staff members here in Irvine. So we are doing probably one of the biggest IVF center in Southern California. And also starting off this year, and we have another center in Arcadia, and also starting to do egg retrieval and embryo transfer. So hopefully we can help more people get pregnant and hopefully help them to fulfill the dream of the family.
Amazing, amazing. So what got you into this reproductive endocrinology field?
I always believe sometimes in your lifetime you meet some people and that will be change your life. And so I think one of the thing which introduced me into the field of women's healthcare is probably my mother. And so she was an OB/GYN doctor, and so she practice OBGYN in the rural area of China, and when I was very young. So I know how much she helped the people and how much people appreciate the work she did for them. So after I finished my medical school and I choosing to study for OBGYN as my master's degree in China. So because of my trainings OBGYN as my master's degree, so that's get me into this field. And after that, and actually I fortunately met a person, his name is Richard Duclos, and he was associate dean and also professor of Michigan State University. And so we met in China, and he invited me to become his PhD student. And so I went to Michigan State University and did my PhD, working with him and studying the embryology and endocrinology. So this is after I finished my PhD degree, then I joined Wayne State University as an embryologist. So actually, my first official job was in the field as an embryologist. I work in the lab and to fertilize the egg with the sperm and making embryo and help a couple to have a baby. So I think that was 1991. So I think from 1991 up to now, this point is close to 30 years. This is a long period of time.
Wow. So you're born infertility specialist from your mom. I didn't know, but actually you are embryologist as well.
Was trained as embryologist, that's correct.
That is very unique. So I know you call the precision IVF. So what is exactly precision IVF?
So before we talk about precision IVF, I just want you to know, and right now almost the entire United States and most of the country and the people still doing the conventional IVF. And when we say conventional IVF, which means no matter what's your age, no matter how good ovarian function, and the doctor always using one similar protocol and basically give patient a few weeks birth control pill, and after that, and give patient a high dose gonadotropin injection, like a 40 stem manipul, 450 or 600 units gonadotropin injection every day, and for 10 to 12 days. On the average, doctor can get about maybe 20 or 30 eggs, and sometimes get a lot more. And I remember during my training, and so one of the doctors, she retrieved 89 eggs at one egg retrieval. So I think because then you'll be producing lots of embryos, and some patients just need one child, and so what to do with all the remaining embryos? And that's a huge problem for the society. And also patients spend a lot of money on medication, but there's lots of leftover embryos. They don't know what to do with those embryos. So I think so-called precision IVF is to try to away from the conventional IVF, because we are based on the patient age and your fertility goal and how's your ovarian function. We targeted, design a protocol and suitable for that patient. And for example, if patients are young, like 32 years old, so the only reason she cannot get pregnant is because her tubal was blocked. So for that patient, I know if I do not use medication, just get one egg out, make one embryo, and if I put the embryo back, she has a very good chance to get pregnant. So if that's the case, why you need to spend $5,000 medication to produce 20 or 30 eggs, get her pregnant? So I can achieve the same goal. So that's how the precision IVF come from. So our first precision IVF case was done 2012, and that's patient a couple and the young couple from Houston, and both are physicians, and they have all the financial resources to do IVF in Houston, but decided to do IVF here with me because they know we can do IVF without medication. That's all they wanted. They just want to do IVF, use no medication. So we did, and we did a complete IVF, take one egg out, and using one sperm, and make one embryo, and then we genetic test the embryo, confirm the embryo was a healthy female embryo. So then we transfer the embryo to her, and then she results pregnancy, deliver a very healthy baby. So that's very precise. And one egg, one sperm, one embryo, and one baby. So that's the precision IVF came from. And obviously, and later, and obviously, if patient, for example, 36 years old, and we know at her age, and so she may need 2 embryo to have a successful pregnancy, because a woman at the age of 36, average about 2 embryo has one chromosome normal embryo. So for those patients, we can get 2 embryo and most likely should be get pregnant. So that's you use a little bit medication instead of produce 20 or 30 eggs. For her, we can just produce 4 to 6 eggs. So that's how precision IVF come from. And because of this, and American, the patent and the trademark office, and granted the precision IVF to the trademark for Life IVF Center. So we own the precision IVF, the trademark.
Wow, that is amazing. That is excellent. But I also noticed that you have a lot of patients with the advanced maternal age, correct?
That is correct.
And then that patient, if they do, so they usually egg retrieval happen every month, and then you have maybe one technically. Is that true?
Depends.
And it takes.
Good question. And for women with advanced maternal age, which means 43, 44, 45, 46, 47, for those patients, we always tell them very clearly in front of, because we want to know the fact. And with women's age increase, and the probability of that can be successful even doing IVF also decline. The reason decline of the success rate is because of their embryo very easy to be chromosome abnormal. And as I told you earlier, so a woman younger than 34 years of age, the chromosome normal rate is about 2 out of 3. So women between 35 to 37, the chance of embryo to be normal is about 1 in 2. For the woman 38 to 40, the chance of embryo to be normal is about 1 in 3. For the woman aged 41 to 42, it's about 1 in 4 to 1 in 5. So if a woman over 43, and the chance for embryo to be normal, maybe about 1 in 8 to 1 in 10. So obviously the older woman the age, and so the probability of embryo to be normal are decreased. So for that reason, and so obviously we have a different plan for the patient. So obviously if patient has a good ovarian function, and for a 40 years old woman, we tend to be getting a little bit more eggs. And because we know the probability have a normal embryo only about 1 in 3 and to 1 in 4. So we want to have a more embryo and hope she has a good chance to get pregnant. So each cycle when we do egg retrieval, and we take multiple eggs and make multiple embryo, and then we send the embryo for testing. So if we have a normal embryo, then we can transfer the embryo and then she can get pregnant. If not, if no normal embryo, then we can do egg retrieval again.
Oh, so you pretty much do all like PGS for all the patients?
For the women younger than 35 years of age, and I usually do not recommend to do PGS testing, mainly because of, as I said earlier, 2 out of 3 to be normal, then why test it?
True.
So women between 35 to 37, this is a chance of embryo to be normal is 50, the 1 in 2, 50-50. So for those patients, I give them option. You can do it. If you don't want to do this, okay. But the woman over 36 years old, and I usually suggest them to do. And if women over 40, I strongly encourage them to do PGS testing because women over 40 years of age and the chance for embryo to be chromosome abnormal are higher. So if you do PGS testing and you transfer only PGS normal embryo, so there'll be reduce of risk of miscarriage and also increase your chance of success.
I see. My patient, because actually we have a lot of patients going through your program at this time.
Right.
And their question is, okay, I'm over 40 and I have this PGS. Is there any damage or risk factor? Because they harvest this, and does it make sense?
Yeah, that's a very common question because people is worried about because of the embryo testing. So right now there's 2 testing method. And the first testing method is using called invasive testing. And we need to remove some cells from embryo for send out testing. And because of when the embryo become a blastocyst in the day 5 embryo, the embryo distinguishes 2 different cell population. So one group of cell become a placenta, another group of cell become fetus. So when we do a biopsy, we only remove the cell become a placenta. So because by doing so, you'll be not hurt the fetus. So this is why the biopsy is safe. So I think currently we're still in the study, and so there is a possibility, and then in the next few years, and there will be more using called non-invasive testing. So which means when you put the embryo in the culture drops fluid, and when after culture for a certain period of time, we can remove the fluid for genetic testing, test DNA, and called cell-free DNA test. So by doing so, you can also determine if the embryo is chromosome normal or abnormal. So obviously by doing so, then you will have no injury to the embryo at all. So it will be much more safer.
Thank you so much for explanation, Doc. Because you're an embryologist and a doctor, so that is amazing.
Thank you.
So since, as I said, we have a lot of patients coming to your clinic and then all over the world. And the very first time I discovered your practice is through the patient travel from the Northern California, San Jose.
That's
And
correct.
that time I was, wow, I have to meet this doctor. So what is your expectation for, let's say, like a holistic medicine or natural medicine, for example, like acupuncture during your just natural IVF?
So I think this is fits us very well because, as you said, natural cycle IVF or natural IVF, we try to use in patient body condition and make own adjustment, and so let the natural follicle grow, and so we can take the egg out and give patient the best chance to be successful. And I think for the acupuncture or herbal medicine, for all those things fits in the category. And especially we know, and for the acupuncture working very well for the patient with a certain condition. For example, if a woman has endometriosis, and or if a woman very anxious and very stressful, and so I know the acupuncture can reduce the anxiety and reduce endometriosis pain. Because even from physiology, we know if a woman using the acupuncture can increase the endorphin secretion and reduce the pain. And so people with endometriosis cause severe menstrual cramping, and also because of this, and reduce their chance of success. And so I think a combination with natural IVF with your service with acupuncture certainly be improve the probability of success.
Thank you so much for open-minded for this natural medicine. I appreciate it. So this is one personal question. You know, patients are going through all the stress. What is your favorite de-stress method?
My favorite is just method, and many of them. For a woman, I think overall, I always get patients ask me if you want to do IVF, what you should do. And so I give, besides you find a good doctor and a good practice to help you. And on top of this, for yourself, I think it would be suggested a patient eating healthy diet. And I think healthy diet and keep a balanced health diet. And also I suggest them eating 1 egg a day, especially for women, because the egg has egg white and egg yolk, and certainly be improve the nutrition. And then number 2, I suggest them to exercise. And I always believe exercise is a good way. And for example, and walking and swimming or jogging, because if you exercise, and it can improve the blood flow to the ovary, so improve the ovarian function. And also I suggest women to have a good sleep. And I always believe for sleeping well, and so you looks good, and sleeping well, and you are more energetic. So keep a good sleep. And also lastly, keep positive, because I know in the life, and we always feel stressful, and many things, COVID-19 stressful, and all things work and be stressful. So I think keep a positive, especially for those women have a failed previous success, failed try multiple methods, still not working, but still believe yourself, you can do it. And positive attitude is very important as well.
I love that. I love that. So tell us how patient can find your doc finally.
If patient want to looking for our service, and so you can go to our website, and which is www.lifeivfcenter.com. And also you can find a Life IVF, LIFE, Life IVF Center, and you from Instagram and Facebook, and also WeChat group. And so there's many of the things, the website you can find us. And so also we have hosting a weekly seminar. So each week, and we're hosting a webinar. And so you can listen to my presentation and then share with you our the story, and also success stories. And we also usually invite 2 guest speakers and share with their personal stories. And even if you are a patient and of Dr. Lee, and then you can join our webinar. And actually, all people attend the webinar, you may have a chance to win a complimentary IVF treatment. So that's a lot of people very excited about winning this lottery. So.
I love that.
Yes.
Thank you so much, Doctor, for your time. As I said, you're a really busy doctor. But this will definitely help a lot of our patients and community, somebody interested in your specific talent and then this service. I appreciate it so much, Doc. Thank you.
Okay. Thank you so much for inviting me.
Thank you.